Okay, so today we're really diving deep into type 2 diabetes, and you've given me some super interesting stuff to work with here. It seems like the main thing we're looking at is this Dr. Jason Fung's book, The Diabetes Code. And wow, he's got some big names supporting this, like Dr. Mark Hyman, Dr. Benjamin Bickman. So clearly there's something to this, right? So what are we aiming for today? I mean, how do we even start to unpack all this?
Yeah, it's a lot. I think what's really fascinating here is the core argument that, type 2 diabetes isn't this like inevitable decline, but it's actually at its root a dietary disease, mainly from too much sugar and how our bodies react to it with insulin, that whole system. So we're going to kind of trace, how we've come to understand diabetes over time, how treatments have changed, and really dig into the evidence for these diet-focused approaches to actually reverse it.
Okay, so just to clarify, are we saying that at its heart, type 2 diabetes is all about what we eat, like too much sugar leading to high insulin and then insulin resistance? Yeah. And the book seems to suggest that if we tackle that, the diet part, we can actually get people better.
Exactly. And we're going to try to, put all the pieces together, connect the dots, and hopefully give you a new way to think about all this. So whether you're dealing with diabetes yourself or you know someone who is, or honestly, if you just find this whole global health challenge fascinating, this should give you some really interesting takeaways.
All right, let's take it back a bit. What can we learn from the history of how we've understood diabetes?
Well, one fascinating thing is diabetes isn't new. We're talking ancient Egypt, 1550 BC. We've got the Ebers Papyrus describing excessive urination. And around the same time, ancient Hindu texts, they talk about honey urine, literally describing the glucose in it. So even way back then, people were noticing this issue with how the body handled something pretty fundamental.
Wow, so those key symptoms, they were there all along. Okay, fast forward a bunch to like 1923, we've got this guy, Sir William Osler. What was his take on it?
Well, if you connect this to what we know now, it's pretty amazing. Osler was like a huge figure in medicine, and he actually defined diabetes as a disease where the normal utilization of carbohydrate is impaired. I mean, a century ago, one of the biggest names was already pointing to problems with how the body processes carbs.
That's a pretty big deal. It sounds like they were already on to this diet connection, especially carbs. So what happened? What changed the focus?
Well, here's the thing. The discovery of insulin in the 1920s, it was huge, right? Saved so many lives, especially for people with type 1 diabetes. They even got a Nobel Prize for it. So understandably, this shifted everything towards pharmaceuticals. And the dietary treatments that were being used before, that really intensive nutritional management that guys like Frederick Madison Allen and Elliot Joslin were doing, it kind of got pushed aside.
So it went from managing with food to treating with insulin. And the argument here is that for type 2 diabetes, that was maybe not the best direction in the long run.
Yeah, that's one of the big points here. The book really stresses that restricting carbs for diabetes, it's not some new fad diet. It was the standard treatment 100 years ago. It even mentions how Osler's idea got picked up again later by Gary Taubes, the science writer, with his whole carbohydrate insulin hypothesis. And then researchers like Finney, Volek, Bernstein, they really developed it into clinical models. So the idea has been around, it just hasn't always been, front and center.
Interesting. So while insulin was a breakthrough, especially for type 1, it maybe took the spotlight off of diet as a root cause for type 2.
Hmm.
All right, let's talk about the conventional approach to type 2 diabetes today. What does the material say about that?
Okay, so the source really highlights this prevailing model of calories in, calories out for weight control. And because type 2 diabetes is often linked to weight, this has been the go-to, right? Like energy balance is everything. But the book claims that there's actually a ton of scientific evidence that debunks this simple equation. And if you look at, the trends, type 2 diabetes just keeps rising, so clearly something's not working.
And that calorie-focused model has really shaped the standard dietary advice, right? Like everyone's been told to go low fat.
Absolutely. For years, every major health organization was pushing low-fat diets. But the interesting thing is, even they've started to backpedal, realizing that healthy fats are important. But the whole calorie counting thing for weight and diabetes, that's still the main message.
But here's where it gets really confusing. How can medications, especially insulin, actually make people gain weight when losing weight is supposed to be so important for reversing type 2 diabetes?
Yeah, this is a huge contradiction that the author brings up. I'm sure a lot of people dealing with diabetes have experienced this. You're told to slim down, but then the very drugs you're prescribed, things like insulin or sulfonylureas, they can pack on the pounds. The author even talks about his own patients asking him this, and honestly, there isn't a good answer in the conventional model. It really points to a potential flaw in the logic.
It's like the treatment is working against the goal. And the book's pretty blunt.
Hmm.
You can't fix a dietary problem with drugs alone, right?
That's the core argument. They use this analogy of bringing a snorkel to a bicycle race. It's just the wrong tool for the job. The point is, if type 2 diabetes is mainly about what you eat, then meds alone, especially those that might actually worsen things like insulin resistance by boosting insulin levels, well, they're not going to address the root cause.
Okay, so let's dig into that root cause.
Yeah.
Too much sugar and high insulin. How does the book connect those dots?
Basically, the book says type 2 diabetes is all about hyperinsulinemia, which is just a fancy way of saying too much insulin. And your body pumps out all this insulin in response to all the sugar and refined carbs you're eating. And that's what leads to insulin resistance. Imagine your body has this like sugar tank, and when you keep filling it with sugar, it overflows. That excess sugar spills into your blood, causing high blood glucose.
And the body's natural response to that high blood sugar is to release more insulin, right? Like an emergency response.
Right. Insulin's job is to move glucose from your blood into your cells, where it can be used for energy or stored. But if your cells are constantly bombarded with sugar from all the carbs you're eating, they start to resist insulin signals. Like they're already full, they can't take in anymore, even with insulin knocking on the door.
So the body tries to compensate by making even more insulin, just trying to force that sugar into the cells and keep blood sugar levels normal. But that just makes the problem worse over time.
Yeah, that's the vicious cycle. Pumping out more insulin might temporarily manage blood sugar, but it's not dealing with the root cause, which is all that stored sugar and insulin resistance. In fact, all that extra insulin actually worsens the resistance. It's like if you keep yelling at someone, they're going to tune you out eventually.
Makes sense. So if too much sugar and insulin are the culprits, what kind of diet does the book recommend?
The big thing is cutting way back on refined carbs. Things like white bread, pasta, sugary drinks, basically any processed food that turns into glucose super fast.
Hmm.
It also suggests moderate protein because too much of that can be converted into glucose by the liver.
And what about fat? Didn't we spend decades thinking fat was the enemy?
Yeah, and this is a big shift. The book is all about natural fats, things like avocados, nuts, olive oil, eggs, even butter. These fats barely affect blood sugar and insulin, and importantly, they make you feel full and satisfied so you don't get those blood sugar swings. It even points out that dietary cholesterol, which is often found in those foods, has been proven to have no negative effect on heart health.
So ditch the refined carbs, embrace natural fats, moderate protein, and focus on whole, unprocessed foods. Sounds pretty simple, really. The book also talks about actively burning off excess sugar. How do we do that?
It does acknowledge the benefits of exercise, both resistance training and cardio, but it's pretty clear that changing your diet is way more effective when it comes to reversing type 2 diabetes. And then it talks about fasting as a pretty straightforward and powerful way to force your body to use up its stored sugar.
Fasting. Now, that's something I'm hearing more and more about these days, and the book explains it as basically the flip side of eating. When you're not eating, your body has to use stored energy, and glucose is the easiest fuel source. So by not eating for a while, you're essentially burning through all that excess sugar.
Exactly. It's about giving your body a break from constantly taking in glucose and forcing it to rely on what it already has stored. And this also lowers insulin levels, which, as we've talked about, is crucial for tackling insulin resistance.
This whole perspective really flips the script on how we think about diabetes. It's like our modern diet, with all its sugar and refined carbs, is fueling this whole thing. And the fact that type 2 diabetes has basically quadrupled globally since 1980 really makes you think, I mean, that's a huge increase.
Oh, it's massive. And the timing is interesting too. This surge happened right when we started embracing low-fat, high-carb diets and that infamous food pyramid, which, as the book points out, put the worst offenders like bread, pasta, potatoes right at the bottom. I mean, a fourfold increase in just over 40 years. That's got to tell you something.
And it's not just a problem in wealthy countries, right? The material says the fastest growing rates of diabetes are actually in developing countries.
Yeah, it's a global issue now. Most adults with diabetes actually live in low and middle income countries.
Mhm.
Even in places like Japan, tons of new cases are type 2. And the economic burden of all this, it's insane. It's a real threat to healthcare systems around the world. And the fact that type 2 diabetes is now way more common than type 1 really highlights how important lifestyle is.
So let's talk about the typical symptoms of type 2 diabetes. Do they fit with this idea of the body being overwhelmed with sugar?
Absolutely. The classic signs of hyperglycemia, which is just high blood sugar, are things like increased thirst, peeing a lot, unexplained weight loss even though you're hungry all the time, and feeling tired. And this all happens because when your blood sugar is super high, your kidneys can't reabsorb it all, so it ends up in your pee, pulling water with it. And because you're losing glucose, your body's like, hey, I need energy. So you lose weight and feel constantly hungry.
In type 2 diabetes, it often sneaks up on you, right? That's why it's often diagnosed through routine blood work before people even notice symptoms.
Right. Unlike type 1, where it hits you pretty fast and hard, for type 2, the diagnosis usually comes from things like fasting blood glucose levels, blood sugar after a glucose tolerance test, or HbA1c, which gives you an average over the past 3 months. A random blood sugar check along with symptoms can also point to a diagnosis.
It's kind of wild to think that we actually have a tiny amount of glucose in our blood at any given time. The book says it's like a teaspoonful, which shows how finely tuned our blood sugar regulation is, thanks to hormones like insulin.
Absolutely. Insulin is essential for pulling glucose out of the blood and getting it into cells or storing it in the liver, all to keep those levels within a tight range. But in type 2 diabetes, this whole system gets thrown off because of insulin resistance.
Which brings us to the progression of the disease and all those scary complications. The material talks about both microvascular and macrovascular complications. What exactly does all that mean?
So microvascular means small blood vessels, and when those get damaged, it's bad news. Retinopathy, which affects the blood vessels in your eyes, is a leading cause of blindness. Nephropathy, that's kidney damage, is the main reason people end up with end-stage kidney disease. And neuropathy, nerve damage, affects a huge number of people with diabetes, leading to all sorts of symptoms like tingling, numbness, pain, and even foot problems so severe they can require amputation.
Wow, those are some serious consequences. And then there are the macrovascular issues, the ones affecting the big blood vessels.
Right, so atherosclerosis, which is the hardening of the arteries, happens way faster in people with diabetes, and that puts them at a much higher risk for heart attacks, strokes, peripheral vascular disease, all kinds of scary stuff. Studies like the Framingham Heart Study, they've shown a clear link between heart disease and diabetes. You're talking 2 to 4 times the risk, and the risk of stroke is also way higher.
So if it's not managed well, diabetes can wreak havoc on basically your whole body. The book also mentions other complications, a possible link to Alzheimer's disease, a higher risk of infections, skin problems, even polycystic ovary syndrome, or PCOS, which itself is linked to insulin resistance. It really paints a pretty grim picture if this thing isn't taken seriously.
It does, and it really emphasizes how crucial it is to understand what's actually driving these complications. But the good news is the book also presents some really inspiring real-world examples of how type 2 diabetes can be reversed with the right kind of dietary changes.
Let's hear about those. The first one is Simon, right?
Yeah, Simon was 66 years old on a bunch of meds for diabetes and high blood pressure, high BMI, the whole 9 yards. He was put on a low-carb, healthy fat diet and started doing some intermittent fasting. And get this, within about a year and a half, he was off all his diabetes meds, his HbA1c was normal, he had lost a significant amount of weight and kept it off, and he's still managing his health through diet and occasional fasting.
That's incredible. And the second case, Bridget, she was described as severely insulin resistant.
Right, Bridget had a long history of type 2 diabetes, kidney issues, high blood pressure, the works. She was on a super high dose of insulin every day, very high BMI as well. By changing her diet, the book says her insulin needs dropped dramatically. Her overall health improved a lot, though it doesn't say if she got off insulin completely. But these cases are powerful. They show what's possible.
It's definitely encouraging. Now, let's talk about obesity and diabetes. That connection is pretty well established.
Yeah.
The book gets into BMI, body mass index. What does it say about how those two are linked?
Well, BMI is basically a measure of weight relative to height. And yeah, there's definitely a connection. In general, the higher your BMI, the higher your risk of diabetes. But the book points out some important nuances. Even gaining a little bit of weight within what's considered the normal BMI range can increase your risk. And it stresses that waist-to-height ratio is actually a much better predictor of metabolic problems than BMI alone. So that belly fat, that seems to be the real troublemaker.
That makes sense. We always hear about belly fat being particularly bad, and the book challenges the idea that obesity is just about calories in versus calories out. It suggests it's more of a hormonal thing, mainly about too much insulin.
Exactly. The argument is that if obesity itself is caused by hormones, specifically high insulin, then type 2 diabetes, which is so closely tied to obesity, is also primarily about this insulin imbalance rather than just eating too much.
Okay, that's a different way of looking at it. Let's break down how insulin affects energy storage and how insulin resistance develops. The book explains that insulin's job is to make the body store energy as glycogen and fat.
Right. When you eat, insulin rises, and that tells your body to store the incoming energy. When you fast, insulin drops, and your body starts using those stored reserves. And here's the key principle. Repeated exposure can create resistance. We see this with all sorts of things, and the book says it applies to insulin too.
So, too much insulin, what they call hyperinsulinemia, makes your cells less sensitive to insulin signals, and that's insulin resistance.
That's the idea. Our hormones normally work in pulses with low baseline levels. This helps to prevent resistance. But if insulin is always high, the cells get desensitized. It's a vicious cycle. Resistance leads to higher fasting insulin, which makes the resistance worse and can cause weight gain.
Almost like the body's trying to protect itself from being constantly told to store energy by becoming less responsive to the signal. Now, the book contrasts two models of insulin resistance, the lock and key and the overflow phenomenon. Can you explain the difference?
Okay, so the lock and key is the classic model. It says that resistance happens because there's a problem with the insulin receptors on your cells. Like the lock is broken and the insulin key can't open it. But the overflow idea is different. It says that the cells are already full of glucose, like a packed subway car, and they resist taking in more, not because the doors are broken, but because there's just no room.
And in that model, hyperinsulinemia is like a subway pusher, trying to cram more glucose into these already stuffed cells.
Exactly. Even if the receptors are fine, the cell is full, so the body ramps up insulin even more to try to force the glucose in, but it just makes things worse in the long run, desensitizing the cells even further. They use the analogy of a liver cell getting overloaded with glucose because of all that insulin, leading to resistance within that cell.
So it's like the cells are saying, enough, we're full, especially if you're constantly overloading them with sugars and refined carbs. Now, what about ectopic fat? What's that, and how does it play into insulin resistance?
So ectopic fat is basically fat that's stored in the wrong places, not in your regular fat cells, but around your organs. Visceral fat, that's the fat around your belly, that's a big contributor to insulin resistance. And the liver is often the first place this ectopic fat builds up. This messes with the liver's normal function and how it responds to insulin, making the whole body more insulin resistant.
So fat building up where it shouldn't, like in the liver, and that fuels the insulin resistance cycle.
Exactly. High insulin makes you store fat in the liver. That fatty liver becomes resistant to insulin. That resistance makes your body pump out even more insulin, and you get more fat in the liver. It's a vicious cycle. And non-alcoholic fatty liver disease, or NAFLD, that's incredibly common, especially with obesity and high-carb diets, and it's a major player in insulin resistance. The book also mentions that fat in your muscles and pancreas can contribute to the problem. So it's not just about how much fat you have, but where it is. Fat in fat cells is generally fine. Fat in your organs is not.
And what about the beta cells in the pancreas? Those are the ones that actually produce insulin. We often hear about them getting burned out in type 2 diabetes. What does the book say about that?
Yeah, the traditional thinking has been that in type 2, the beta cells work overtime, pumping out so much insulin that they eventually poop out. But this book presents evidence that they might actually be more resilient than we thought. Studies have shown that with massive weight loss, either through very low-calorie diets or bariatric surgery, pancreatic function can improve, so maybe it's not burnout, but all the extra fat in the pancreas itself that's messing with their function, and that can be reversed. So both the liver's insulin resistance and the pancreas's dysfunction, they're closely connected and often driven by that underlying hyperinsulinemia.
So it all keeps coming back to too much insulin, likely from the way we eat. Now, the book has a whole section on the deadly effect of fructose. Why single out fructose?
Because glucose and fructose, they're handled very differently by the body. Every cell can use glucose for energy, but only the liver can directly metabolize fructose. So when you eat a lot of fructose, it's like you're targeting your liver. And in the liver, fructose gets turned into glucose, lactate, and importantly, fat.
And that conversion to fat in the liver, that's the problem,
Big
right?
time. It directly contributes to fatty liver and insulin resistance. And the thing is, refined sugars like table sugar and high fructose corn syrup, they're about half glucose and half fructose. So you're getting hit with a glucose spike that raises insulin and a fructose bomb that goes straight to your liver. And the book also points out that refined sugars, they don't have the fiber, protein, and fat that's naturally in whole carbs, so you don't feel full and you can easily overeat them. The author even calls high doses of sugar a toxin because of the fructose, highlighting how bad it is for your liver and insulin sensitivity in the long run.
So it's not just about that immediate blood sugar and insulin spike from glucose.
Yeah.
Fructose is more like a slow-acting poison messing with your liver over time. Now, what about metabolic syndrome? Where does that fit in with all this hyperinsulinemia talk?
Metabolic syndrome is basically a bunch of risk factors: high blood glucose, central obesity, high blood pressure, and abnormal lipids all happening together. And the book's argument is that all these seemingly separate problems actually have a common cause: hyperinsulinemia. They even call it the X factor.
So high insulin is the thread that ties all those different risk factors together.
That's what the book claims. Hyperinsulinemia is linked to high blood pressure, high triglycerides, low good cholesterol or HDL, all hallmarks of metabolic syndrome. And it's interesting, the book points out that while obesity, as measured by BMI, is often linked to metabolic syndrome, you can have it even if you're not considered obese. Again, it's that abdominal obesity, that belly fat, that really matters. And it's also worth noting that high bad cholesterol or LDL, that's not even one of the main criteria for metabolic syndrome, even though everyone's obsessed with lowering it. And the book even suggests that maybe things like obesity and insulin resistance, they're actually the body's way of trying to deal with the root problem, which is too much sugar.
Like the body's adapting to being flooded with sugar, and those adaptations, while they might help at first, eventually cause all these problems down the line. Now, given this perspective, the book is pretty critical of conventional drug treatments for type 2 diabetes. Why is that?
Well, it talks about major studies like the UKPDS, which showed that those older meds, sulfonylureas and insulin, they didn't really do much to prevent complications in the long run, and they often made people gain weight. Metformin did show some benefit for the heart, but the book suggests that might be for reasons beyond just lowering blood sugar.
Hmm.
And even more concerning, those big trials like Advance, Accord, VADT, and Origin, where they tried to really tightly control blood sugar with all sorts of drugs, they basically failed to show any big benefits for the heart, and in some cases, they even seem to cause harm.
And then there's this idea of insulin toxicity, even in people with type 1 diabetes who have to inject insulin.
Exactly. Since they don't make their own insulin, any hyperinsulinemia they have is from the treatment itself. But they can still develop a lot of the same problems as type 2 diabetes, which suggests that too much insulin from any source can be a problem. The book even raises the question of whether high blood sugar itself might be the body's way of trying to protect cells from being overwhelmed with too much sugar inside them. And there's some evidence from animal studies that insulin can contribute to atherosclerosis, and some human studies have linked insulin use in type 2 diabetes to an increased risk of dying.
That's a pretty serious indictment of relying on medications that either increase insulin or don't do enough to lower it. And then the book goes on to categorize diabetes drugs based on their effect on weight and insulin. What's the rundown on that?
So some of those older drugs like sulfonylureas and TZDs, they tend to cause weight gain by increasing insulin. DPP-4 inhibitors, they're pretty neutral on weight. And then the newer classes like SGLT2 inhibitors and GLP-1 analogs, they can actually help people lose weight, often by lowering insulin or making people feel fuller. Notably, there was this study, the MPA-REG outcome trial, that showed heart benefits with an SGLT2 inhibitor, which, as you know, lowers insulin, and the book highlights that as significant. So the takeaway is those old-school oral meds that either don't affect insulin or actually raise it, they don't really work that well long-term, and they might even be harmful.
So from this perspective, the focus should be on treatments that tackle the high insulin, either through diet or meds that help lower insulin or get rid of excess glucose. Now, the book also addresses that classic advice of cutting calories and exercising more to manage type 2 diabetes. What's his take on that?
Pretty critical, to be honest. The book argues that the standard low-fat, calorie-restricted diet that's been the go-to advice for years, it hasn't really worked to reverse the type 2 diabetes epidemic. It talks about the history of these guidelines and how that flawed food pyramid pushed everyone to eat tons of refined carbs. And while some guidelines have loosened up on fat, the whole calorie counting thing often misses the mark because, as we've discussed, it doesn't address the underlying hormonal issues, that high insulin.
And what about exercise? We're always told to move more for our health.
The book acknowledges that exercise is great for you, but says the impact on reversing type 2 diabetes is often exaggerated. Weight loss from exercise alone is usually minimal, and people get discouraged, they don't stick with it. And for some people with diabetes complications, exercising can be tough or even dangerous. So the bottom line is, if you want to reverse type 2 diabetes, the priority has to be fixing your diet, specifically lowering insulin.
Which brings us to things like bariatric surgery and low-carb diets. The book talks about bariatric surgery. How does that work?
So procedures like Roux-en-Y bypass and sleeve gastrectomy, they often lead to dramatic weight loss and diabetes remission in a lot of patients. And the book's take is that the main reason this works is because of the sudden and severe calorie restriction that's basically forced by the surgery. It's like surgically enforced fasting, which brings insulin levels down fast. So again, it reinforces that whole idea of lowering insulin being key.
And then there's the power of low-carb diets, which this book is a big advocate for.
Definitely. It highlights how consistent these diets are in lowering blood glucose, insulin, body weight, waist size, the whole package. It explains the idea of glycemic load, showing how refined carbs cause a much bigger and faster spike in blood sugar compared to unrefined carbs. It even talks about traditional societies that eat a lot of carbs but stay healthy because their food is unprocessed and they don't eat much sugar. The recommendation is a low-carb, healthy fat diet to get blood sugar down, lower insulin, and burn fat, emphasizing the crucial difference between good carbs and fats, the unprocessed, whole food kind, and the bad processed kind.
And last but not least, fasting. The book presents it as this ancient practice that's been around forever and has huge potential for healing, especially for burning off stored sugar and getting those insulin levels way down.
Absolutely. It tackles the idea that fasting is starvation, explaining that the metabolic slowdown that happens with chronic calorie restriction, that's not what happens with intermittent fasting. Studies have shown that your metabolism doesn't really take a big hit with fasting. And remember, reversing type 2 diabetes is about both stopping putting sugar in and burning off what's already there, and fasting is really good at that. But the book is also very clear that anyone with diabetes who wants to try fasting needs to do it with their doctor's supervision and adjust their meds accordingly.
The book also touches on lifestyle changes for preventing diabetes, mentioning successful studies like the China Daiqing study and the Diabetes Prevention Program. What was the common denominator in those?
All those successful interventions had one thing in common. They lowered insulin. Again, it circles back to that central argument about how crucial insulin is for metabolic health.
And the big takeaway seems to be that type 2 diabetes can be reversed, which is a hopeful message, especially compared to the idea that it just inevitably gets worse with conventional treatment. The book even shares more success stories like Alberto and Lana, who made amazing progress through diet changes and fasting.
Yeah, those personal stories really bring it home. They show how people who've had type 2 diabetes for years have actually gotten off their meds and gotten their blood sugar under control using these alternative approaches.
Okay, let's bring it all together. What's the main takeaway from all this?
I think it's pretty clear that type 2 diabetes seems to be primarily a disease caused by eating too much sugar and having chronically high insulin levels as a result. And the conventional approach, focusing mainly on lowering blood sugar with drugs that often either raise insulin or don't do enough to lower it, that might not be addressing the root cause, and it could actually be doing more harm than good in the long run.
And what was the most surprising thing you learned from all this?
Honestly, how much we demonized dietary fat for so long without any solid evidence, and how those refined carbs, the stuff they used to tell us to load up on with that old food pyramid, that's what really spikes blood sugar and insulin. And the idea that fasting could be such a powerful tool, maybe even more effective than bariatric surgery in some cases for weight and blood sugar control, that was pretty eye-opening.
What about the biggest aha moment for you? Something that really clicked?
For me, it was understanding that whole vicious cycle of high insulin leading to insulin resistance, which then drives insulin even higher, and how important ectopic fat is in that process. And the idea that maybe all those things we see in type 2 diabetes, they're actually the body's way of trying to protect itself from all that sugar, that was pretty profound.
So what does all this mean for our listeners? What can they actually do with this information?
I think it empowers you to really think critically about the different ways to manage your metabolic health. It encourages you to consider changing your diet, specifically cutting back on refined carbs and added sugars, and maybe explore intermittent fasting as a treatment strategy, always with your doctor's guidance, of course.
And finally, what's a thought-provoking question to leave everyone with? Something to ponder.
Given all this evidence connecting sugar to type 2 diabetes and the possibility of reversing it through lifestyle changes, What if we completely changed our public health recommendations? What impact could that have on global health and healthcare costs? It makes you think about the big picture and maybe even inspires you to learn more about low carb diets and fasting for metabolic health.